you look like you need some milk. Do you need a little bit of milk? Should we get you some milk, little baby? I think so. Are you getting a little hungry?
Gonna finish taking my temp on Charlie. I don't know if we filmed, but he had an abscess, but now he's been fostered out and he has had diarrhea for the last month, and he's been vocalizing when he goes poop.
Sure. That's not really here. Let's just do the Lopez method of holding kittens. Let's just put this here.
The solo vet.
Yeah, just hard for a dependent. I love my technicians. I think they are the stars. So I've had to learn so much. When I'm not with them, it sucks.
Yeah, so here you can see the mass. It's red and swollen, so right now I'm just exploring this draining tract. Pippa's owners are currently renovating. Do you see that? Is that hair?
Hold on. I do see it.
Just hair?
Yep.
They're currently renovating, so they're also worried that maybe she stepped on a splinter or a nail. So we've been seeing lots of grass-ons lately.
Like, can you say how it's all, like, it's stemming from that one point?
I don't know. It was something that was thick. Okay, so now I'm just gonna do a betadine flush. We got what we think may be a piece of foreign material out of there. We have a nice draining tract. I've debrided the area of any infected tissue. Now I'm just flushing with prepidine solution just to aseptically flush the wound. And then what we'll do is we'll get the owners to do an Epsom salt soak daily for the next few days. And there's enough inflammation, redness in this area that I would want to put on antibiotics as well. So we'll put Pippa on some antibiotics. I don't know what it is. It might just be like a cystic hair follicle. It's just really thickened and I'm not sure. So I'm gonna take a hair from her as a comparison. I feel like Sherlock Holmes. So this is a singular hair of Pippa's. Mystery unknown. Don't know for sure. I can't definitively say if it's a grass-on or an infected follicle, but it's out regardless. So now we will recover Pippa. Just put a little bit of Theraderm on there.
Okay.
And call the owner, and Pippa should be standing there waiting for me when I get home, ready to bark at me.
I think all the other cases were pretty, pretty standard vaccination cases and stuff like that. We still have a lot to get through for the rest of the day.
Taz had an interdigital cyst recently, and we had treated with antibiotics because we couldn't find anything there. And then the last time he was in, I was flushing it and I found a foxtail embedded right in there. But now it's healed and he's perfect. So he's just in for a recheck. This pup also is a little bit anxious, as you can tell. So I also just filled a prescription for Prozac for him. Sometimes our pups need some extra anti-anxiety medication. So I'm just gonna let me listen to his heart and give a feel since he's in love with you today.
Yeah, we became besties when he was in for his very first visit.
'Tis the season for foxtails. We've had some really rewarding cases over the last couple of weeks. And then Tazzy here has that little foxtail right embedded into his skin. But they can go everywhere.
I hurt my back So Rob,
no.
yeah, Rob is here to help us with the lifting. These are today my clients. Oh, Christina's bringing her rescue today. And so this little puggy, like he has all the weird teeth. Everything is a little crowded there for this girl. If you compare this side to this one, do you see how she has two teeth that are parallel?
Yeah.
There shouldn't be that way, but because she's a pug, she doesn't have a really big mouth. There's not a lot of space, so her teeth are growing next to each other this way. And then when we compare to the other side, she's missing one of these ones. So she's missing a premolar. And then right here, she should have a little premolar there. So she has it on her x-ray, and it's just rotated. And it's under the gum. So this is something that she needs to have extracted. Retained like that is that they can, the body will try to get rid of them somehow. And they can get a cyst. It's called a dentiginous cyst, and it can break their jaw eventually. So that's why we want to make sure that we're proactive. She's only a year old, and probably this is something that wouldn't be a problem for years. But wait, why wait? But we'll just refer her to the dentist and make sure that they take care of that.
Sky Blue is a 14-week-old Wheaton Terrier who's in for distemper parvo combo vaccination and rabies vaccination. Deworming. Sky's ears have been inflamed for the last 5 or 6 days, so we just did ear cytology, and we'll be looking for bacteria or yeast and treat appropriately if we find an ear infection. And then Sky Blue also has base narrow mandibular canines. So our bottom canine teeth, I know.
You're okay.
We're bad. We don't have to open your mouth. Our bottom canine teeth are more narrow than the top, so the bottom canines are digging into the hard palate. So the owner is going to try some manual physiotherapy for a couple weeks before considering other options. So essentially you can push, those bones are still pretty soft, so you can manually spread those, spread the jaw a little bit and get those teeth realigned. It's also called ball therapy, but ball therapy usually is reserved for adult canine teeth that are base narrow. Basically making your dog chew on a hard rubber ball, and it acts as braces. If neither of those work, then surgical fix, so just pulling out those baby teeth. There's a high likelihood that we're also going to have narrow adult canines as well, so either extractions or orthodontics are both options there.
You did it. Good girl. Good girl.
Sky Blue can go back to 6,
Okay.
and just let him know I'm just working on the ear cytology.
Okay, perfect.
Thank you.
Kevin is a 2-year-old intact male English Mastiff that presented to us for a history of anorexia for a week and a half and intermittent vomiting. He went off his kibble about a week and a half ago. The owners have been feeding him ground beef for the last week, but the last 2 days he hasn't wanted to eat anything. During this period, he's also been vomiting, and the owners are unsure whether or not he's been defecating at all. He also has a history of 6 months ago, he had a foreign body surgery to remove toys that he had ate from the neighbor's yard. So the owners are suspicious that this could be potentially the same thing that's happening again. Took some x-rays. My biggest concern was the stomach was kind of abnormal looking, and then there was definitely a decreased serosal detail on the x-ray. So this means just that we're not getting good detail of what's going on in the intestines or the rest of the abdomen. The loops of bowel that I could see on the on the x-ray looked really, really large compared to what I would expect to see in a dog that hasn't ate for a week and a half. Other than that, the x-rays didn't look super abnormal. I couldn't see necessarily two populations of intestines, but for sure just these really, really large intestines. So we did pop the ultrasound on. I couldn't find an exact obstruction, but it is extremely abnormal and somewhat suggestive of a foreign body or an obstruction with having these large loops of bowel, especially with the history of not wanting to eat. So somewhere there's a blockage that's not allowing things to move. And as of right now, we have him hooked up to IV fluids, started him on some anti-nausea medication, and then this afternoon we're gonna hopefully go in and do an exploratory laparotomy to try to find the obstruction and remove it, and then continue treating him for foreign body.
I think he might have just fallen asleep in my...
So this is Cap. He is a working dog. So he works on a ranch chasing bulls and cows all day long. He presented last week with severe anemia. So he was shaking. He was he didn't have enough energy even to stand up in his hind end, and his gums were super pale. We ran blood work. He was severely anemic, meaning he didn't have enough red blood cells. So we sent away some diagnostics. We treated him for fleas. He actually had a pretty good flea infestation, and then also started treating him for what's called immune-mediated hemolytic anemia. So essentially where the red blood cells are being attacked by the body, and that's why his red blood cells were so low. So we started him on steroids, and I've been checking on him over the last couple of days. So I had him in on the weekend to look at his blood values, and now we're gonna run his blood values again. So it's just a checkup to see that he's improving on his anemia. I'm also gonna see if we've got a handle on the flea infestation. Got some different medication just in case he's still a little bit itchy, but he's a super sweet boy. He's a worker. He's a good dog. Yes, he's very smart and very brave. Do you want to go get your bloods, John? Look, it's Cap, Yolanda. It's Cap.
He looks good, eh?
Right? He's so happy.
Hi, Cap. How are they going?
So we're just gonna do a CBC.
Oh, you look nice and pink.
He's got some pink. Jody, your best friend's back.
So this is a flea comb, and it you'll see fleas jump. There. No, that's just dirt.
So flea bite anemia is a real thing where you have so many fleas you actually get the blood sucked out of you, or the fleas can cause a hypersensitivity, which then can set up the immune-mediated anemia. Rub your head on him, and then tell me if you're itching.
I'm itchy just thinking about him. Last time his fleas were all crawling around his shoulders.
Let's take your bloods. It's a little poke. You bite bulls for a living. You literally bite bulls' feet for a living. I know. I know. So this is a 14-year-old miniature Schnauzer who he was abandoned and found in a dumpster. He peed in his kennel and laid in it. He's covered in pee. Oh, Phineas. I know. This is my dog. So Finn's been peeing in the house lately. So we're just gonna run a geriatric panel and do a urinalysis just to make sure he's healthy and there's nothing going on. And then looks like I'm gonna be giving him a bath. Mm-hmm. Oh, it's so sad. He was so healthy until January 2020. That's when he first started having exercise intolerance, and he just couldn't go on the hikes he used to. And then now he's completely deaf, nearly completely blind. So it's really sad to watch the old guys go. I know. That's so sad.
You getting your urine sample as well?
Yes. Do you want to drip it out of his fur? 14 is great though. I always said if I could get 15 years out of him, I would be 100% happy. So we've gotten close. He's still able to get around. There's nothing visibly wrong with him. He doesn't like to be groomed anymore, so that's why he's a shaggy beast, because he just doesn't know what's happening, right? He just, like right now, I'm just holding him, and he's scared, right? Because he just wants to go to sleep. He just wants to have a nap. So now we're gonna take some urine, just rule out things like a urinary tract infection. Hopefully there's some pee left in here.
Did you just give him a bath, Cody?
No, he went in his pee.
See, he doesn't even like getting a bath because he just doesn't quite know what's going on. Should I throw a fitty bomb at Nina? Oh, that's so nice to have a bath. You shaggy beast. You shaggy Schnauzer. There we go. There we go. Okay. Go run around. Go run around. So this is Phineas's blood work. So I'll run through everything. The red is abnormal. So his red blood cells are just below the low normal range, which means he could potentially be anemic, but based off of his age and all the other parameters of his red blood cells, I'm not at all concerned. So from a red blood cell perspective, it looks great. From a white blood cell perspective, it looks great. So he doesn't have an active infection going on. It doesn't seem. And let's look at, and his platelets are good as well. His SDMA, which is a kidney enzyme, is elevated, so 25, and the normal reference range is 14. And that's significant to some extent. So what we do is we look at the next two kidney levels, and those are normal in Phineas. He also had 1+ cocci or bacteria in that sample, and that sample was collected by a needle, so there shouldn't be any bacteria in there. Now, we don't see any white blood cells, we don't see any red blood cells in the urine, but he does have some bacteria floating around there. So I may consider treating him for a UTI or urinary tract infection, and having the specific gravity just on the cusp and also having this elevated SDMA, that tells me that we need to do a follow-up urinalysis and SDMA and kidney value follow-up in probably 2 or 3 months. Looking at the rest of things here with Phineas, the only other abnormal thing is his ALK phos is elevated. The other liver enzymes are normal. ALK phos is a liver enzyme, so it could potentially indicate some liver disease that is going on with Finn, but he's not really clinical for anything, so it might just be an abnormal finding. Overall, for a 14-year-old Schnauzer, it's a pretty good result, but we'll just follow up with some advanced imaging diagnostics just to see if we can't drum something else up. But yeah, so suspect kidney disease and a urinary tract infection. They're taking very good care of you. I didn't get a chance to do an x-ray on him today, but maybe on the next episode we'll review his radiographs. Not too concerned, but it's always hard when you're working on your own pet, and especially when they're elderly, you never know what you're gonna find. And I know his time is close, but we'll try to keep him as happy and comfortable for as long as possible. Okay, let's go find you a little drink. Yes. And then we'll go check Cap's blood work, but I think he's gonna be fine. Oh, that's such a nice baby. What a terrible job to have a little puppy. For adoption. For adoption soon.